Hi guys, Kyla here from Bijoux Med Spa. I'm here to talk about our UltraClear laser. UltraClear laser is a new device. It stands out on its own. There's no other wavelength like it. It's a 2910 wavelength that is closest to an erbium type laser, which is a 2940 wavelength. Its competitors are resurfacing type lasers like CO2 and erbium. These are lasers that are used for deep skin tightening and resurfacing. People who have a lot of sun damage, brown spots, deeper lines, folds, and wrinkles, especially around the mouth. Really great for tightening the skin around the eye. There is some downtime associated with this laser, but it's typically a lot less than the traditional resurfacing lasers. Best candidates of this laser can range all the way from a skin type 1, somebody with super fair complexion, all the way up to like a skin type 6, very dark complexions. What's cool about this device is I can really dial down the treatment settings, and I could use it very safely on darker skin types. So what's different about this laser compared to its competitors like CO2 or erbium, or really any device out there, is that it does have cold ablative laser coring technology. So this is using a laser beam to core out very quickly and with very little thermal downtime, little tiny pieces of skin, which causes collagen formation and skin contraction. And this can be done on many different skin types, which is also unique to this laser, because before we can only use laser technology because it's heat-based on lighter skin types 1 through 3, like a lighter tan, because we'd have to worry about side effects such as hyperpigmentation. All right, so let's talk about how to prepare for this treatment. So I go over all of this in detail with my patients. I like patients to have everything that they need to take care of themselves properly whenever they come home from this treatment. This is making sure you have all of your supplies, like 4x4 medical grade gauze. You can order that off Amazon and stuff like that. That you have distilled white vinegar, because you're going to be doing vinegar soaks mixed with distilled water the day after. That you have your pre-care, which is typically a Lacin nectar. That is something that preps your skin and gets it turned on and cranking and ready to take care and heal itself. And if you have darker skin, I'll usually prescribe a prescription hydroquinone topical to help prevent against hyperpigmentation from this laser. So you'll need to pre-treat with that, typically 3 to 4 weeks prior to having the blade of laser treatment done if you have a darker skin type. And then also making sure that you have the correct oral supplementation afterwards, because it's not just important what we're using topically on our skin, but also how we're taking care of our bodies afterwards, and that it's in an optimal state to promote healing. So these are all important things that I go over with patients. I want to make sure that they have a full understanding of how to use them so that you get the best results possible. All right, what to do the day of the treatment. The biggest thing is to really help a patient manage their pain, especially when I'm doing some of these more intense skin tightening resurfacing treatments. So I'm typically giving a patient beforehand a prescription of Percocet and Ativan. I have them fill that and bring it in with them the day of the treatment. They take it right before we apply a topical numbing. That topical numbing is typically a mixture of lidocaine and tetracaine. We let it sit on your skin for an hour, and then we may sometimes do some nerve blocks, just depending on the treatment settings I plan on doing, especially around the eyes or periorally. And then we have Pronox as well, nitric oxide. So I usually recommend all my patients get the Pronox. It's well worth it. It helps keep you comfortable throughout the procedure. It gives you something to focus on, breathing in and out of the Pronox tube, and it does relax you quite a bit. But that's typically what you can expect with the treatment. If I'm doing a face, it's typically somewhere in between an hour to an hour and a half treatment. For face and neck, somewhere in between an hour and a half to 2 hours. Now, what to expect after the treatment? After the treatment, you're going to be hot. You're going to be on fire. We do have a Zimmer cryo chiller that we can use during the treatment and after to really help cool down that skin. So we have that device in office to make the procedure more comfortable for you. You will be applying your post-care treatment products. I include this with my laser prices because it's so important. It's like a non-negotiable. Now, when you get home, the first night is going to be the worst night. We do give a second dose of pain medication that you could take that night. You'll want to have a clean pillowcase at home that you can sleep on. You will probably ooze on it. I would suggest getting a white pillowcase so you could bleach it, because your skin barrier is open. It's disrupted. We are resurfacing it. Just doing cold compresses with just distilled water, reapplying your elastin products. That's pretty much all you're doing the first night. When you wake up the next day, that's typically the worst day. That's where you're going to see the most swelling. You're going to be probably a little scabbed, still oozing, and maybe just a little bit of pinpoint pleating. You'll still be using your Lassen products. You will start on your water and vinegar soaks. You'll continue those for really 2 to 3 days. Past the second day of the treatment, the swelling starting to go down. The scabs are getting a little bit darker. You're not really oozing at that point. You're still doing the vinegar and distilled water soaks. And then next day after that, it's a little bit of the same thing, but just a little less swelling. By the 4th or 5th day, the really cool thing that I see with this laser is it's like a 180 turnaround. All those scabs start to slough off. You start to see this nice, beautiful pink skin underneath. So it's really that like 4th or 5th day that we see that. So it's a really impressive turnaround time. By day 7, most patients, the scabs have sloughed off. Patients are usually just pink at that point, maybe a little bit dry. Depending on how intense of a treatment that I did, that redness can potentially last anywhere from 2 weeks to up to 6 weeks. So everyone's a little bit different. It depends on your skin and how well you're taking care of it at home. But all in all, it's a really impressive treatment. We can get some beautiful results for less downtime and pain that we have seen with traditional resurfacing lasers in the past. So if you have any questions, feel free to reach out and ask. We love our UltraClear device.